All right. Thanks a lot, Al. Much appreciate the opportunity and the leadership that you, Emil, and so many others have brought to this initiative and trying to raise the awareness. Session here today is on a personal level, a bit of a deja vu. Some 25 years ago, Steve had the idea of creating the first national conference on the reintegration of injured workers. I had the privilege of supporting that a little bit, and since that time, there's been some progress in some areas, but I think we've got an awful long ways to go. So when Alan asked that I perhaps be able to contribute a little bit to the discussion today, she says, look, it's pretty wide-ranging when we talk about gaps and opportunities. So I thought I'd take this down a slightly different path than what we've heard so far today, and take our discussion from a supply side down to the demand side. When I talk about the demand side is, what is it that we want to achieve? And we've heard this before in terms of actual outcomes. And where do we want to be? I mean, Mike had, talked a bit about the changes in BC, but at the end of the day, some of them are positive, but who would want to, or some of us don't have a choice, but the reality is to exist on $906 a month is pretty terrible, to say the least, and it doesn't actually take a hell of a lot to get to that level. When you look at CPPD, we are looking at about $1,100 maximum a month on CPP disability, and you only get there if you've actually worked for some 6 years, and you've got a 50% rejection rate, and most people have to go through 3-4 appeals, and having been involved in some of some of the CPBD stuff at the Service Canada side, where actually individuals die, those that have terminal cancer, some of them get accelerated, some of them don't. So when we look at the poverty side, which is huge, I think we all want to maintain equitable roles in society. I was, on a personal level, extremely fortunate. I got hurt in a logging accident more than 38 years ago. Went back to work. It was first week on the job. Here's a power saw. Good luck. Go for it. And a 50-foot tree broke my back. I was able to continue working and stay in the workforce, but out of 350 people with severe spinal cord injuries under the age of 65 in our system in British Columbia, less than 5% of them are actually in full-time employment, and obviously vast majority don't work at all. So what I really want to just focus on a couple of key areas that in my view are basic and quite elementary if we want to achieve some real change in the way we deal with this, and that is we need to deal with attitudes and we need to look at leadership. And we've heard this many times with respect to Mike Bradley this morning. When I talk about attitudes, I just want to give you an example of a Harvard review that came out earlier this week. Actually, I'm going to give you two. The Harvard review is the first one. As part of the Americans with Disabilities Act 25th anniversary, Rutgers University did a major research piece whereby they sent out job application letters to a whole range of employers in response to positions that were advertised. And what they did was they identified themselves. So there were 3 application letters. They were fictional application letters for jobs that actually existed. So they used 3 disability types to identify themselves. One was a spinal injury, one was someone with a severe mental health issue, and another individual with episodic disabilities. Those that had self-identified found themselves getting calls back 26% less than those that did not self-identify. So that gives you a bit of a sense of the attitudinal barrier, where we are in 2015 after we've had the ADA for 25 years. In terms of the point that Mike Bradley made, as part of the Olympics and Paralympics, disability became one of the pet priorities for our premier in British Columbia. You know, we're going to have this great framework. I was part of the Ministers' Council. We had what was called a 10 by 10 strategy. The goal was that by 2010, 10% increase in employment in municipalities and cities for persons with disabilities. The minister personally challenged everybody and was very engaged, Claude Richmond, in this. And we were not able to get above the 2/3 mark in terms of, even though he personally intervened, getting municipalities on side. And that was simply the reality of it. So we've got a long ways to go with respect to changing attitudes in that regard. Then when we look at leadership, I just want to look at this type of leadership can be both positive, can also be very, very negative. When I look at the type of changes that came about as a result of, and I'll deal with this a bit more, when we look at as a result of the changes that we saw in the workers' compensation system in British Columbia in 2002, when the government changed, there were two types of reports commissioned. One was a report on how benefits could be cut. One was a report on how services and programs could be improved. The report on improvement of service and benefits and programs was thrown into the garbage. The report on how we can cut benefits was implemented lock, stock, and barrel. As a result of that, the suicide rate of injured workers and the rate of suicide threats went from 6 in 2002 to well over 200 by 2010. That was the direct consequence of great political leadership, whereas this was seen as to where we go. And that's the point that Andy made earlier, where it's a race to the bottom on how can we go and reduce costs. In this case, it's been a straight transfer of wealth for workers to the employer community, in many cases, in this case, employers that are not even residing in our province. So there's a lot of things. One of the negative examples when we talk about leadership is something that's came up over the last federal election. So why has Canada not signed on to the optional protocol on the UN Convention? Most jurisdictions around the world have done that. Part of the problem, of course, is that the moment that you sign the optional protocol, then you can open yourself up to an investigation by a UN commission. Now the UK is in the proud situation of being the first country in the world that actually currently has a UN commission on site. Last week, part of that is, last week the BBC reported that the drastic changes that were made and are being made by the government in the UK with respect to re-examining, because it is one federal system, they don't have the segregation of the programs that we have. It is a public policy system with respect to WCB, short-term disability, and long-term disability. The review of everybody on disability support, no matter how long they've been on the system, has resulted, estimated so far, in about 600 suicides of individuals. So the optional protocol, of course, allows a review by an international UN body to do that. That's another example of when we talk about leadership and how we can actually move this forward. So then, what I would see is shifting the paradigm from a notion of what we currently have and what we should be doing to a system of what's our vision, where do we want to be, and how do we want to get there. We know that almost 60% of Canadians with disabilities live below the poverty line. We know that under the Federal Employment Equity Act, over the last 10 years, there has been no improvement in the hiring rate of people with disabilities. The latest report from 2014, showed essentially that the number of terminations was actually greater than the number of hirings. So there's a number of pieces in terms of what we need to do, where we need to set targets, in my view, and work from those targets backwards with very clear measurements, with standards, with some expectations, and what are the consequences of failure, and hold individuals accountable if we don't achieve those results that we are looking for. Specific pieces we could look at, there are legislative structures in place. We know that what gets measured, that gets done, and if legislative pieces are enforced, they do get done. We saw again in BC, if I look at health and safety as a model, as an example in this regard, in 2002, about 1/3 of all health and safety regulations were eliminated in our province. A huge chunk of health and safety inspectors were eliminated. By 2005, in our province, we had 188 industrial fatalities. We had the dubious distinction of having the highest per capita industrial fatality rate out of 60 jurisdictions in North America. So these are the kind of pieces that we need to look at. What are some of the legislative structures that we could look at? I want to briefly talk about the employer labor agreements. We were involved in developing the Enhanced Disability Management Program in British Columbia. And while there are certainly some teething problems, no question, this is a huge step forward. When I got hurt in 1977, long before most of you were around, there was absolutely nothing. I went back to work and got back to work because there was a huge sense of collective guilt on the part of the employer and the union. Under the Enhanced Disability Management Program, across the entire healthcare sector in BC with more than 120,000 employees, nobody is going to fall through the cracks. All four unions, as well as all of the health employers, have created a system, enshrined it into the collective agreement. The program kicks in the first day of an occupational injury, the fifth day of a non-occupational injury. And there is a seamless system and process in place. Other unions are looking at the same, but we're obviously not there yet. In terms of the some of the other options are obviously employer return to work obligations. Not every province, BC and Alberta, are the only two Canadian provinces that currently do not have an employer obligation under our workers' compensation legislation. There are employment requirements that we could be looking at, again, always working backwards from setting a very specific target to say, look, it's unacceptable that the unemployment rate for people with disabilities is well over 20% higher than the general population, and say, where do we want to be? And how do we basically get there over time? In terms of some of the other instruments that are there, Michael talked about that. Since Steve had organized this conference, we now have an ILO Code of Practice on Managing Disabilities. We have a UN Convention. We have best practice guidelines, and I think all of us across Canada, certainly we in British Columbia, are looking towards your success in implementing the AODA and making it a national model that can be used right across the country. So here are obviously some leadership opportunities at the corporate level. I heard this earlier when I worked for Weyerhaeuser. My boss, I was working for the CRWDP, always talked about the great notion of doing the right thing. Well, it never happened until on January 1st, 2002, he was told that 25% of his compensation was going to be tied to the company's performance in health and safety and return to work. So obviously kind of changed his mind and changed his attitude. So same applies to union and government levels. And so I think one of the key questions that I've challenged individuals and organizations with is, how do we remove ideology from evidence-based decision-making? Why is it that when governments change, then that they move forward with their ideological agenda, as opposed to looking at the type of research, the type of evidence that these type of initiatives that you're part of here bring and give us and show us, and how do we actually build individual and organizational leadership without personal experience? Individuals that have gone through this And we heard earlier this morning from Mike Lake. I'm not sure how much he would be involved in if it wasn't for his personal experience. So sorry to be a bit longer, but appreciate the opportunity. Congratulations to the organizers for a great event.